Let's talk about anesthesia at time of egg retrieval. Egg retrieval is a minimally invasive procedure where, under ultrasound guidance, we are using a long needle to extract eggs by basically piercing each follicle within the ovary and then draining them to completion in the hopes of getting as many eggs as possible. Without sedation or anesthesia, you would likely feel lots of cramping and pressure and discomfort. This is why it is typical to use deep or even just conscious sedation, which involves giving medications through the IV. Often these are medications like benzodiazepines to help a patient relax, as well as maybe a small dose of opioids like fentanyl, or heavier medications like propofol, where the patient is in a deep sleep. They're able to breathe on their own. They don't need to be intubated, but they won't feel or remember anything at the time of the procedure. Prior to the patients starting their cycle, we will evaluate their medical history, and if there are any concerns in terms of anesthetic risks, we will have a low threshold to have them get medically cleared and to even visit with our anesthesiologist and consult with them about any additional measures that may need to be taken for safety or precautions prior to the start of their cycle. Anesthesia is given so a patient is not in discomfort and is not suffering needlessly during the procedure, but it's also a safety issue. You want to make sure that people aren't moving around on the table while the needle is in their ovary. You want to make sure that their pelvis is stabilized and still. So giving anesthesia is a really important part of doing the retrieval in a complete and effective way and making sure that we're being safe the entire time. The goal is to go into the cycle fully prepared, and if there are chronic medical conditions or issues, to make sure everyone on the team, including anesthesia, is aware and that there should be a really specific plan in place to mitigate all risks and make sure it's as safe as possible. But occasionally, things will come up during the cycle. For example, someone can get sick where they have an upper respiratory infection. And, all of these are things that should be discussed with anesthesia, and they can always modify the plan and still administer anesthesia, but in a way that makes sense given the medical status and condition that the patient's in. So typically you can continue forward even if you do get sick during the cycle, but it really depends on the situation and the severity. And, the anesthesia can be tailored to the situation to make sure that anesthesia can still be administered, but done so in a safe and effective manner.